Hello, welcome to chapter 21. In this first of two video lectures, we're going to be talking about the core rules for coding signs and symptoms. We've touched on this before in other chapters, but now we're going to give you some more structure in terms of when and how to code signs and symptoms. Let's have a look. And again, this is abnormals, clinical labs, signs, symptoms, not elsewhere classified. All these codes begin with the letter R and fall in a range of code category R00 through R99. At the conclusion of this, you should know when it's appropriate to code a sign or symptom, when it's not appropriate to code a sign or symptom, and how abnormal tests are handled in ICD-10-CM. This chapter is all about what we know versus what we don't know at the time of the patient encounter. So again, we talked about how these codes run in a code category range of R00 through R99. And these include circulatory respiratory systems, symptoms related to the digestive system and abdomen, skin and subcutaneous system, nervous system and musculoskeletal systems, genitourinary system, cognitive and emotional states, speech and voice, and other general nonspecific symptoms. These codes are only used when there's no confirmed diagnosis. If there is a confirmed diagnosis, we don't use the code or the sign and symptom if it's inherent to the disease process of the diagnosis. And we'll get into more of the weeds on this in a bit. Codes that describe a patient's abnormal findings range from R70 through R97, and these include abnormal blood urine results, abnormal findings in body fluids or tissues, abnormal imaging or function studies, abnormal tumor markers. These are objective findings. These are documented through diagnostic testing rather than patient complaints. One code category, R99, is for quote unquote ill-defined and unknown causes of mortality. So this category does not describe any symptoms or lab findings. It's used when the cause of death is unknown or unclear. And we'll talk more about this a little bit later in the lecture. Okay, so what exactly are signs and symptoms? Are they the same thing? Are they not? These get thrown a lot around a lot. So let's define these. A symptom is subjective. It's reported first by the patient. Some examples of this include chest pain, shortness of breath, abdominal pain. All those are symptoms, right? A sign is objective. It's observed not by the patient, but by the provider, or it's documented through some sort of diagnostic test. Some examples of this include abnormal lab results, imaging findings. So think of it in this term. The subjective symptom comes from the patient. The objective sign comes from either the provider or the test the provider ordered. Some symptoms, such as urticaria, gastrointestinal hemorrhage, hives, what have you, are classified in other chapters because they're strongly associated with a specific organ system. Chapter 21 is used for symptoms that are non-specific, affect multiple systems, or have unknown causes. Objective signs are, you can think of them as measurements. They're non-specific. They're things that come from diagnostic testing, labs, imaging, function studies, what have you. And abnormal tumor markers are those biochemical substances such as CEA that or PSA that are associated with the presence of some sort of a tumor. These findings must be documented. They're not based on patient complaints. This chapter includes signs, symptoms, abnormal test results, and ill-defined conditions. These are only used, very important here, when no diagnosis that's classifiable elsewhere has been established. Signs and symptoms that, or symptoms, I should say, that clearly point to a specific body system are usually classified in that body system chapter, not here. And this prevents duplication and improves diagnostic accuracy. This chapter also includes conditions that are pointing to multiple systems and conditions that don't have enough information to determine a diagnosis or are temporary or unexplained conditions. Some of these are described as not otherwise specified, unknown etiology, or transient. So when do you use these signs and symptoms codes from this chapter? You would use them when there's no specific diagnosis that can be made after evaluation, when the symptoms are temporary and resolved, when a patient doesn't return for a follow-up. We see this a lot in the emergency room where somebody comes in, they're seen with chest pain, they don't stick around for a cardiac workup for whatever reason. That's appropriate to use a symptom code for this. If the patient's referred elsewhere before diagnosis can be made, if a more precise diagnosis is unavailable, or if the symptom itself is clinically significant. The big question you have to ask yourself here is, was a definitive diagnosis established? So again, just kind of a repeat of what I've said on the earlier slide, but worth mentioning. If somebody goes somewhere else for investigation or treatment before diagnosis is made, appropriate to use a sign or symptom code. If you have a more precise diagnosis, it's not appropriate to use the sign or symptom code. Okay, and the last slide here, and this is a very, very important one, excludes notes. Many of these codes from this chapter will include excludes one notes, which means that you can't code it. Specifically, you can't code it with an established diagnosis code. And these notes will direct you to codes in other chapters and prevent incorrect symptom coding. Always read the notes in the tabular, and they exist to protect you from these coding errors. And that's all I have for you right now. Come back for our next video lecture where we'll talk more about coding signs and symptoms, including the Glasgow scale and other things about signs and symptoms. That's all I have. We'll see you online. Bye now.